Welcome to this HCP Live Geriatrics Peers and Perspective presentation titled Proper Nutrition in Older Patient Populations. I'm Dr. Simon Murray. I'm an internist from Princeton, New Jersey. Eating right and staying fit are important no matter what your age. And as we get older, our bodies have different needs, so certain nutrients become essentially important for good health. Over the past decade, the importance of nutritional status has been increasingly recognized in a variety of morbid conditions, including but not limited to cancer, heart disease, dementia, in persons over the age of 65. Today, to discuss these challenges, I am happy to be joined by Jane Schwartz, a registered dietitian and nutritionist who offers a holistic approach to individual and family nutritional counseling. Jane earned her Bachelor of Science degree in nutrition from Cornell University and completed a graduate nutrition internship at the Oregon Health Sciences University in Portland. She's also served as a nutritional counselor for the United Healthcare. Welcome, Jane. Let's begin.
Hi, thanks. Nice to be here.
Most physicians that I know, including myself, don't know very much about nutrition. The best thing I used to tell my patients was never eat anything handed to you from a window. That was about the best advice I could give them. Or we would say follow diet and exercise. So I think we would like some perspective about ways that we can improve upon educating our patients about nutrition. How prevalent do you think the problem is of malnutrition?
I think it's very prevalent. And as we were discussing, whether someone is underweight or even overweight, there can be malnutrition because there's a misconception that someone who has extra weight is actually lacking in certain nutrients. Yeah. And you can see just because the diet can be very high in processed foods and lacking in fruits and vegetables and whole grains and certain things like that, that they can have lab numbers and disease states that indicate a state of malnutrition.
Yeah.
Yeah.
Are there statistics that talk about the extent of the problem of malnutrition in the elderly in the United States?
I think that there haven't been a lot of statistics. There haven't been that many studies. But in the few that have been done, I mean, it can be as high as 50% or more.
Yeah. Mm-hmm. I know in hospitalized patients, the rate is rather high.
Yes.
And that's a select population, I guess, of people who come in who are sick. But I know when people are in the hospital, my patients, if I know people over the age of 65, if they're in the hospital for a week, it may take them 6 months to recover.
Absolutely.
Because we keep them in bed and we don't feed them.
Yes.
Not deliberately, but they don't get fed.
Yes.
What do you think the challenges there are? Why does that happen?
You mean in the hospital?
Yeah.
Well, people's appetites are poor, they don't feel well, so even if there's food coming in the hospital, they may not be eating very much, and it's going to take a lot for someone to put them on a tube feed. Like, that's a very serious decision. So prior to that, they could be lacking in a lot of nutrients. Their trays go back, they're not eating very much. Plus, I have to say the hospital food isn't often all that great. Yeah. So they may not be getting wonderful nourishment at the hospital, and they're not feeling well. They're just not getting what they need.
It may be as simple as not being able to open the packages either, or having someone patient enough to feed them.
Yes.
Or them not being able to order because they're out for a test or they're asleep or something like that.
Absolutely.
That I see commonly. Mm-hmm. But as outpatients, what are some of the issues that keep elderly people from getting proper nutrition? Do they differ a little bit?
Well, it depends on what their home situation is. So if they have a caregiver, if they have, a spouse that's well enough to help take care of someone who's elderly and, not in great shape or able to cook for themselves, if they have, daughters or sons that are, helping them, part of it is just lack of education. They may not really even understand what constitutes a healthy diet to not get in what they need. So there's many factors.
Yeah.